start with the first question for each of you. And that is, you're all coming from different backgrounds and different experiences, just like all of us in the room, right? So Akili in organizing, politics and unions, Sheila in health profession as doula, crisis counselor, and then policy and grassroots activist, and Naomi is an educator, writer, researcher, and public policy designer. So yet, each of you and all of us have ended up in this room here together. So we all have a common purpose of wanting a just, affordable, accountable system of care for everyone, and to make amends to equalize the care and truly establish healthcare as a human right, as a public good. We want it protected, honored, and we want it universal for everyone. So I'd like to know from each of you, and let's start with Akili, since he was last, now he'll be first. What it is that brought you to this room, what brought you into this movement, what made healthcare justice important to you, so important that you are here tonight.
Well, I think you may have alluded to it in the opening with my bio. For now, that bio is over. For now, 52 years, I have tried to live up to those three beliefs. But in the late 80s, I got involved with Neighbor to Neighbor in our healthcare security campaign and learned about single payer and universal healthcare. So from the late 80s through now, I've looked at and been involved in one, fighting for universal healthcare, two, using a single payer system, and three, making sure that people accepted, understood, and acted on what we all seem to believe, but haven't quite been able to make happen yet. So through these 50 years, and just on healthcare alone, I guess it would be over 35 years, but to move away from the privileged society, where if you can have it if you can afford it, to a just society, where we include healthcare, housing, jobs as a human right. And so that is a large part of what drives me. And having worked and focused on racial, economic, and social justice, one of the glaring things that you see, and you saw it in the film, was this privileged society where you have, if you can afford it, you can get the best. But if you can't afford it, well, too bad.
We call that apartheid.
And medical, and Dr. Helen Washington's book on medical apartheid really graphically talks about that. And so that's in large part what drives me. It is my history, it is my experience, and my commitment.
Thank you so much. Yes, and Naomi, Dr. Zodi, what brought your focus to healthcare? And you do healthcare economics, correct?
Yeah, so I study health economics and health insurance, and when I was starting out grad school and I was looking at the Affordable Care Act, it was being implemented at the time, and I thought that I was going to study like how it was really great. And I was like modeling all these things. I was throwing all these. I took an entire extra year of graduate school just because I was like, it looks like these high deductible plans are not actually that useful for people. And yeah, so then eventually I was just like, no, it's true. Like when the median deductible is $4,000 and $5,000, so you're paying hundreds of dollars every month, but then you're still paying for all of your healthcare. Mm-hmm. That's not like a rational choice for people to make. Mm-hmm. And so I didn't think people were going to sign up. And then after I graduated, their predictions about how many people were going to sign up ended up being way higher than the actual number of people who signed up. And so I was kind of like, okay, so that's my role. Like, I think that people who design public policies don't know who they know, but
they know each other.
They know each other, but they don't know the people that they're making
room
it for.
That was in the movie, right?
Yeah, their friends are books, and that's it, I think.
Yeah.
So
was there anything earlier before you went to school? What brought you to want to study that?
I wanted to do like an MBA, MPH dual degree at one time and be like a healthcare administrator, but I just couldn't do that. I don't have a neat story for like how, my parents are from Ethiopia, and so I was like a global health minor, because when I was out there, I'd go to like rural parts of Ethiopia where people are peasants, this is like where my mom was born, my dad is more from the city, but like they live very close to the land. But it also, they don't produce a lot of excess money, so like how are they gonna get an MRI machine? You know what I mean? Like we have to, and the thing is like nobody is going to have an MRI machine in their bathroom. Like it's something that we have to do collectively. So we have to think about, okay, where is the pot of money, and how do we set our society up in such a way that like people who don't necessarily produce a lot of excess money still have access to technology, and none of us produce enough excess money to have our own hospital. So anyway, it's a necessarily collective endeavor, but I guess it's just when I was there seeing the way that the people live with the earth, then it became really stark. And from there I was just like, all right, how do we devise policies that make these things happen, that like value these people's lives? That's wonderful.
Thank you. And Sheila, you have a background in some clinical practice as a doula and as a crisis counselor. So maybe there were other things that brought you there, but so tell me, what is your perspective? What brought you to single payer and thinking something like CalCare, which is what we're working for, CalCare, single payer universal healthcare, right? Mm-hmm. It's on the table in 2024. So what brought you to making this a centerpiece of your work and your advocacy?
For me, it was a lot of things. One of them is, as an abolitionist, right? It's about the duality of tearing down systems of harm, such as policing and prisons, but it's also the creating of systems of care. And right now, our quote-unquote healthcare system, or as I refer to it, our sick care system, because one, the system is sick, and two, they don't care about you until you're sick, and they don't even care about you then. Seeing it as that this is a way of building up literal systems of care that people don't have access to. And also thinking about and seeing and witnessing and experiencing the trauma that people have experienced through the healthcare system by virtue of finances, a lack of access, and the literal trauma that it puts on people because of the medical apartheid and because of the way that it treats certain people, especially Black folks, especially Black women, especially Black trans folks, and the way that it has done so much harm to so many people. And it's also inaccessible, and it's just deeply problematic to me. And I was raised in a family where you can't just talk about it, you've got to be about it. We were always taught, if you stand for nothing, you'll fall for everything. And so those values really stuck with me. I'm a grandchild of a labor union organizer with the UAW. It was bred into me. And then also just learning and being outraged by the data, right? Like knowing that this country pays more money per capita on healthcare and we have nothing to show for it. The fact that we pay, like, think about that. We pay more money per capita on healthcare and people do not have access and are going bankrupt and are literally in medical debt because of this. And having experienced it as well and seeing it happen to family members and friends, it's just like, it's outraging. It's an outrage, and I can't not do anything.
We did get one thing. Go ahead.
On your point about like how we spend so much more, but like what do we have to show for it? What's crazy is like, so we spend 1.5x on the number 2 highest spending country in the world, and yet we have fewer physicians per capita on average than most other countries. We have fewer physician visits per capita. We have fewer hospital beds per capita, shorter average length of stay, conditional on diagnosis and admission. So we use less healthcare. We just spend a lot more money overall. So it's not even that we're like, we don't even get care. We just spend money, we just throw it away.
And can I add to that too, like the fact that then the excuse of why we don't have socialized medical care is because, it takes too long for you to see a doctor. There aren't enough doctors. Nobody's gonna want to be a doctor if they aren't paid all this money, right? And yet that data that you just said, proves the opposite of it, and the fact that none of it makes any sense. It's literally off the back of racial capitalism. Like, that's what this is all about, and we cannot forget that, and we cannot not name that.
Well, we did get some benefit. We are number one in preventable death in the world. That means we're number one in having people die that wouldn't die if they lived anywhere else. We're also number one in disability, avoidable disability, like all the amputations we do here for diabetes, which would never happen in single-payer universal countries, right? And we also are number one in having medical debt and bankrupting our citizens. So we did get something out of this system, okay? And that's what we got.
We also have the highest maternal mortality rates. We also have the highest infant mortality rates. Like, it's wild. And we sit here and say we're number one, yeah, and the worst things possible.
So this film only dealt with a part of the system. So I'd like to ask you, Naomi, what about this film did you find like the most important thing for people to know? Did you find anything in it that was like surprising? Did you find anything you objected to? Kind of your general impression.
Well, I thought it was really good. The things that it covered, it did a really good job of, especially the idea of like all payer rate setting, or, you know, I thought they made it like kind of understandable in a way that just we should have a rational way of deciding what prices are instead of what hospitals do now, which is these charge numbers that like are just numbers they just pull out of thin air, and then they negotiate with insurance and the numbers change a little bit, but like the prices that like a hospital will charge you $1,000 for a Tylenol or whatever it is, you know, and some people know that you can negotiate that price down, but that's a whole process, and it's like, why are we even doing that in the first place? Like, we should all come together and have rational payments, and those payments should be the same whether you have a public insurance or private insurance, because, you know, obviously we know like right now Medicaid, Medi-Cal here pays less than Medicare pays, and Medicare pays less than private insurance pays, and it will necessarily create segregation in who is going to accept your insurance, and that's exactly what we have. It's only logical. Of course it happens this way. So those hospitals that have $2 billion in excess reserves or whatever, they should they have that money because the safety net hospital closed down and didn't get that money. So that is all medical care dollars. A lot of it is subsidized through whether it's the tax exclusion for private insurance, employer-sponsored insurance, or it's Medi-Cal, which the state pays these private insurance companies to give you, which I don't even know why private insurance is involved really in any of it.
Right.
That's where all the money is going, by the way, instead of going to doctors so that we can get the care that we needed, which was the whole point of it in the first place. But all of that money that these hospitals that have private insurance patients have, and they just build it up in these reserves, all of those are healthcare dollars that, if we decided to have a rational plan for it, could have been shifted towards providing care in the safety net community hospitals and preventing them from closing down. So we don't have to like spend more money on healthcare to get universal access. We just need to be thoughtful about who's going to get it and who's got too much.
So redistribution.
Absolutely, a redistribution, yeah, even from these nonprofit hospitals. I think that the main thing that the film left out, and they did a really good job of showing that, I think the main thing that it left out is the role of insurance. They didn't really talk about insurance at all. They only talked about the hospitals. You know, these hospitals, yeah, they're fleecing us, but at least they're giving us health care. What is the insurance company doing?
Right.
Except stopping you from getting health care by putting a deductible, a prior authorization, narrow networks. That's literally what we pay them to do, is prevent us from getting health care, and we pay them a lot of money to do that.
They only extract, right?
That's it.
So, Baba Keeley, how did you find the film? What did you think was most important for people to know in that film?
Well,
Were there
it
any
reinforced and
surprises?
reminded me of the medical apartheid.
Yes.
One of the things that I thought was a shortcoming was that it tended to put the responsibility for changing it on the individuals. It's public policy makers, the people who we elect to do that. The other thing that it always reminds me of is that almost everybody knows this in some way or other. And you would think, shit. And because, I mean, if you listen to people and they talk about their insurance company, I mean, nobody likes their insurance companies. Nobody. I mean, it's like we hate our insurance companies. And so, and to your point, the insurance companies only provide paper so the providers can get paid. That's all they do. But they take a large chunk of money to do that. So why is it then that there is a resentment level against insurance companies? There is the understanding and perception that something is wrong, but every time there is an effort to do something about it, it is undermined, resisted, and ultimately killed.
Yep.
In large part, for me, it centers around a couple of things. One, the white supremacy, institutional racism, individual bigotry, and mass denial. And you see it in institutions across this country. Our education system is not working, in large part because I don't think I should have to pay for them immigrant kids. They coming over here and taking stuff, or them bad, kids who are shooting at each other all the time. It's all just gangs over there. Why should I pay my taxes for that? And if you can send that message, and that's a consistent message, then I don't feel responsible, because they're taking, I'm giving, and so that film, it emphasized the take and the give, and then you have people who believe that I got it, I deserve it. If you want it, do what I did. Now you can't if you're black, because you can't turn white. But that's the assumption. So for me, the takeaway was, one, this is not an individual problem. This is a social and social responsibility. Secondly, that we have to be able to talk about universal in the terms of, and I think y'all's title kind of sums it up, all of us, which means that we have to make room, space, comfort, and support for all of us. And that's not going to be easy, because some of us don't think that all of us should be in this room.
Wow. Yeah.
And then finally, I think we are going to have to say and accept that it's not a question of we don't have it, that last point that I make. We live in the absolute richest country in the world. We can have a just, fair, and equitable society. So when people say we can't do that, or we can't afford that, or what they are saying is, I don't want to do it.
Right.
And I don't have the will to do it.
Right.
And if you get it and I get it, and we have a culture, a zero-sum culture in America. My inclusion means your exclusion, even though we have this abundance. And if you couple racism to that zero-sum culture, then you get the kind of unequal society that we have now.
And to your point, 71% of all healthcare dollars spent in the state of California are our tax dollars. So when the unhoused person buys a bottle of water, they paid a tax, and they bought somebody's healthcare. They bought the manufacturer of that water bottle's healthcare. So we are really all paying for it anyway.
One other thing.
Yeah.
The absolute absurdity of connecting healthcare to your work it just makes no absolute sense. Because if you decide you want to get or move a job, you got to constantly talk about, well, what about my healthcare? The other factor that connecting it to your job is that it causes it's a tax within almost everything that's produced, because the producers include healthcare costs in that, because they got to pay for it. Right. So a car that costs $1,000 or $10,000, they jack up another $5,000 because they got to pay for healthcare costs. Yeah. And one of the benefits, I think, of health of single payer, it's like Social Security. We all pay into it, and when we need it, we can get it. It's an insurance. It's a universal insurance. And so I just wanted to say that, because those are two factors. We drive up the cost of goods and services because we connect healthcare to our jobs. If it were not connected to our jobs and a universal system that we were all in, the cost would be spread out and it would be much more affordable.
Very, very good point about the hidden cost, because we are all paying for all of us anyway. So, Sheila, how about you? What did you find in the film that you thought was like most important? Did you think, was there anything you thought was something you took issue with, or were there any surprises in the film?
Yeah, so forgive me, I took some notes because
God forbid,
I've been working since 6 o'clock this morning.
You're forgiven.
And so I went to bed hella late last night, so excuse me. But I think the thing that was most important for folks to get out of the film is how screwed up the healthcare system is, right? And how holistic that is, right? So often we talk about big pharma, right? And we talk about the way that it's connected to our jobs, right? We talk about all these different aspects, but very rarely is it pointed back at the hospitals and the way that they're overcharging, the way that they're continuing this racism and the racial capitalism that is embedded within their system. So I think that, for me, was one of the biggest things to take away from it. And in terms of anything that was surprising, it was sort of all of it and none of it simultaneously, because it was surprising and that it's appalling, but it's also expected because that's what this country is. And then also, that's seen in the fact that the treatment we get in the hospital, and sorry, hold on, I'm trying to make sense of my notes. Which is seen not only by the treatment we get in the hospital, but also the insurance companies and the system at large, which is meant to care for us, which it fails at, but also remembering that the system itself created these problems through pre-existing conditions that are mostly the result of social determinants of health, right? This is the lived environment that society created that is creating all of these problems, and then we aren't able to get access to healthcare, right? So it's just how deeply embedded all of this is. And I think in terms of things that I think were left out, I think it talked about racism and capitalism and the problems with it in like large brushstrokes, but I don't think they honed in on it enough and really named it for what it was and what it is, of the fact that it is racism and it is anti-blackness specifically, and the fact that it is racial capitalism that is driving this problem continuously, and that the lack of access to care and discrimination has very real impacts. As a doula, like throwing this out there, I would be remiss if I didn't, as a doula and as a womanist, that Black women are 3 to 5 times more likely to die than white women, right? Black infants are 2 times more likely to die than white infants. That is a part of the system, and we have to name that explicitly. We can't just say, oh, it's racist, right? Say exactly how it's racist. Name it, because until we name it, we can't face it. And then I understand the title, but the title sort of irks me because it's not a broken system. It's a system that's working as it was intended, but it wasn't intended for all of us. It was not intended for Black people. It was not intended for people who were poor. It is not a broken system. It is a system that is working as it was intended, but it was not intended for all of us.
Wow, very good.
Actually, one other thing, real quick. Looking back at my notes.
Absolutely.
I don't think they also named the absurdity of these charges, right? I don't know if you know, but hospitals have been known to charge for skin-to-skin contact. Meaning after you give birth to your baby, they will charge you for holding your own child. That is literally something that they will charge you for. That is the absurdity of this system. And again, we have to specifically name it. We can't talk about it in generalities. Until you name it exactly for what it is, we can't face it, and then we can't change it.
Ooh, that's absolutely.
That's
Yeah, you've seen this in, it was mentioned in the film that 1 billing agent per bed, but actually we have hospitals that have, I think it's the one in North Carolina, that has 1,500 billing agents for 900 beds.
Wow.
And the job of a billing agent is to find every little thing that you could possibly be billed for, okay?
Including skin to skin.
Yes, including skin to skin. So, so we know this is an enormous problem, and we have hospitals closing all the time. California, in the last 12 years, has lost 100 hospitals. We've lost 100 hospitals, and our rural hospitals are at risk now of closing. I think in the country, there's 2,500 rural hospitals, and about 800, almost 900 of them are at risk of going bankrupt. So we see that this funding of the hospitals equitably, not just equitably, make reparations, bring hospitals in CalCare. It's not just global budgeting, but it's giving extra money to the hospitals that have been discriminated against and have had haven't had the resources that they've needed. So it's to try to equalize these hospitals. But beyond that, what do you think, and I'm asking you, Naomi, how do you see this improvement if we get our CalCare, when we get our CalCare, that hospitals are sort of reinvigorated with this funding? What do you see are like the benefits to a community? What do you see beyond just that hospital?
I mean, I would go even bigger, and sorry, I'm gonna have to leave right after I answer this. But I think it's bigger than just the.
We'll miss you.
We will.
It's bigger than just the hospitals, because I think that when we have like an intentional way of paying for medical care, we can, so first of all, what we can do is, instead of having some hospitals that have all these like high paying private patients and other ones that have public or uninsured patients, we would even it out. So rural hospitals and hospitals in underserved areas would just be getting more money because they would be, each life would be valued equally. So they won't face bankruptcy and they won't have to close down at such high rates. But more than the hospital itself, I think it's about being able to pay for care that is really deeply embedded in communities. So having, there should be a free doctor stationed here at this community center that is paid for through CalCare, so that people can very conveniently, walk by and see their doctor and have a relationship with that person, and they're from this neighborhood. And that can be a service that's provided. So if we have like public servants who are medical care providers, then we can have them embedded within community spaces, and I think, and so from doulas to just all different kinds of preventative care, if everything isn't just about maximizing revenues, if it's about like a rational public plan with community democratic input, then we can come up with so many ways of how we can care for ourselves and each other.
Thank you. Thank you, Naomi. Thank you so much for coming. We really appreciate you. Safe trip. Safe traffic home. So, Akili, how do you see any additional benefits to a community if a hospital is fully funded? What else do you see happening?
Well, one of the things that I would want to focus on is public health care is underfunded across the board. Because we have this medical apartheid, or we have this system, this two-tiered system of privilege, if you can afford it, and then there's everybody else. So for me, it would be, how do we invest in public health, period? And then secondly, how do we then equalize it? And then thirdly, how do we make it equitable? And there's a fourth, and the people who know me know that I generally don't go beyond 3, but I'm going to do a fourth here. And it's the struggle against the culture that allows this to exist in the first place. And that is the struggle for me and many, all of us in this room. It is that struggle. It is the culture that says, if you got it, you deserve it. If you don't, then you don't deserve it. How do we, and underneath that is, of course, racism, the denial and deprivation of a people's history, humanity, and right to freedom based exclusively upon race. And underneath that is this unwillingness and an undermining that because you are black or brown, you don't deserve it. And we blame you for your condition. We say, if you are poor and ain't got a hospital over there, that's your own, that's why, what you need, see, what you need to do is you need to get you need to, and here's what, and you need to, and so we blame people for their conditions. And then we contribute to that public policy decision by either not wanting to do anything. Sheila just shared some statistics with us about the birth rate and infant mortality. Those numbers say a lot. I mean, and you can go in almost any indicator you want, whether we're 9% of the population in the city, but 33% of the people locked up. Now that's mathematically impossible, you would think, except that we get locked up 3 and 4 times, the same, kind of thing. And you can use that indicator in every category. And at some point you gotta say, and I hear white people say this to me all the time, well, I'm not a racist, or, but then how do you let this public policy exist? Well, see, what it is, I love Martin Luther King. and that becomes a response. But that public policy is an outgrowth of the white supremacy and institutional racism. And that's ultimately what has to be. We know what works. We know how to deal with it. We know the time, cost, and resources it'll take to do it. But then when we propose it, when we say, here, and people say, yeah, you're right, but not now.
Yes.
But
delay.
But you know what? And even good, decent liberals, when you say single payer, or when you say the hospitals ought to be held accountable, or when you say we got to create a system, a healthcare system for all of us, starting with the people who don't have it. When they say yes, you're right, but I don't think we can afford it now, or let's work on that, or let's do a research. As a matter of fact, let's form a task force.
Working group.
Yes, a working group.
How about a commission?
Yeah, a commission.
And a committee.
Yes.
Let's have another assembly committee, and then a Senate committee, and then a governor's commission.
And while all that's happening, people are dying.
Yes. Every day. Yes. Every day. Today, at least 10 people died today in this state who wouldn't have died with a single payer system. And they're going to die tomorrow. They died yesterday, next week, the week after, the month after, on and on and on. Martin Luther King said, since we go to Martin Luther King, justice delayed is justice denied. But it's more than justice denied. It's denying people the right to live if we continue this system. Delay and incrementalism are murder. They are murder.
He also said that the white moderate is the biggest stumbling block.
Exactly.
Which is why we have to argue for healthcare as a human right.
Yes.
If we continue to let it be a privilege, if that you can afford or you can't afford, then it's on you.
Right.
But if it's a human right, then we fight to protect human rights. We fight to uplift human rights. We fight to make sure that some of us, if we agree that it's a human right, and that's the concern, is that what has happened, and you see it, I think, in the film, is that medicine has become a profit generating source, and because it's not for the good, it's not for making sure that people get well, it's not for if they get well, that's great. But we really want to make some money here, and we want to consistently do it, and we want to go for the people who can afford it, and the rest, well, we'll figure that out later.
It is the commodification of a human right.
Yes, and
it is the commodification of a human right.
So we have to fight for healthcare as a human right.
And I like what they said, a public good.
Yes.
That's also something I think that we need to elevate, as that we are the public, right? You talked about individuals, being the problem. I'm like, it's just about me. But public is all of us. And that's why we have a society, a government, a country, right? Is to provide for all of us the things that we cannot do on our own. And we all pitch in and pay those taxes so that we can have these things, right? So, Sheila, how do you see any additional improvements in communities when the hospitals are well funded and when everyone is treated equally and when there is
equitably?
Yes, and cultural.
Not equally, equitably.
Oh, equitably. That's right. Sorry. And do you see something beyond just the hospital?
Absolutely. So right now, after hearing what Bob Akili was just saying, Tupac's words are ringing in my head. It's funny when it rains and pours, they got money for wars but can't feed the poor.
There you go.
Right? And so we always have money for things that we want to be able to put money into, but we don't have money for things, right? So for example, right now, or just today, Los Angeles City Council just voted to increase the LAPD budget by $87 million, y'all. When they already get over almost 50% of the city's budget. They just got $87 million more. So if they can find $87 million to put in to more policing, they can find $87 million to give health care to the residents of Los Angeles. Right? Like, you can do it if you want to. They can find the money when they want to. So it's convenient when they say that they can't do it. And this is at the state level, this is at the federal level. Think about how much money we pour into the military-industrial complex. Think about all the money we put into the prison-industrial complex. Think about all the money that we put into policing. All the money that is transferred from military to police by transferring their weapons of war to then use them against our communities, right? So they can find money for all of that. So they sure as hell can find money to make sure that people have access to health care. Because the reality is that, and this leads to your question. Sorry for the build up there.
Excellent build up.
Right. But it leads to
right on. Yes.
It leads to answer your question is how this can literally transform communities, right? When people have we are still in the middle of a global pandemic. Like, let's not pretend like we aren't. COVID-19 is still killing almost 200 people a day, right? And so we can't pretend like that's not happening. And so how did we not learn a lesson from the fact that when people are sick, other people get sick? That's how this pandemic started. So if one person is sick, we all are at risk, right? And simultaneously, when one person is healthy, we are all healthier, right? Think about the way that this also makes it so that, think about how many people are in debt and are having to make decisions of whether or not they're going to pay their bills, feed their child, keep the lights on, or be able to pay their bill when someone's hounding them to pay for something that they shouldn't have to pay for because healthcare is a human right, right? Think about how many people are forced onto the streets and are houseless because they weren't able to pay for their bills and they lost their home, right? Think about all of the ways that these things are interconnected, and we cannot forget that. So it literally can transform our communities, and this is what public safety is. Healthcare, CalCare is public safety. LAPD is not public safety, right? This is what public safety looks like. Well-resourced communities is what public safety looks like. When people have access to healthcare, mental health care, and are able to not only survive, but thrive, crime goes down, and we don't need no bitch-ass cops. Excuse my language. I'm gonna say it what it is. Say it how I feel it in the moment. But that's what it is. It's so much more. It's also, I'm an anti-capitalist, but it also gives people jobs, right? This creates well-paying jobs for people. And so while we're still living under the weight of capitalism, people need jobs. And so this gives people jobs, which also keeps them off the streets, which also lowers crime. It's literally transformational, y'all.
Yes!
Freaking sense.
Yes!
I just wanted to add, she ain't lying because today that $87 million proposal got scrapped and they got defunded an extra $3 million. So that's a $90 million cutback. So what she said is
that's good.
manifested today.
Yay, celebrate.
I wouldn't have known because they asked me to leave earlier.
You've been kicked out of better places.
You got it lucky, Bobby Killer. They took one of our partners to jail.
Yeah,
he's out
when
now.
you talk about, security, when you think about, right now the situation is we are losing jobs. We are losing healthcare jobs. Hospitals are closing every week. Hospitals are cutting departments out, and they're firing people. They're letting people go. I mean, in the thousands every single week all across this country. When we fund the hospitals, that's a job creator, right? Not just doctors and nurses and the techs, but janitors, gardeners, plumbers, electricians. What does that do for a community? Good jobs. Look at any hospital. What does a hospital have around it? It has all kinds of cafes and different kinds of shops and different kinds of services all around it. In addition, you're going to have a community.
This is what CalCare does.
Yeah, CalCare. You're going to have people who are healthier and not prematurely and unfairly disabled because they didn't get the care that they needed. So the enrichment of a community goes beyond what happens even within the hospital. It is an investment in an entire community. And the fact that the West Side people on the west side live 15 years longer than the people in South Central. And that's part of that number that is just disgusting, and that is a choice, right? It's a political choice. And I just wanted to bring up one other point about the money and the funding. Yes, we spend all this money on other things, but there have been 22 studies in 17 years, and in every one of those studies, single payer saves substantial amounts of money, substantial. In California, there was a study done in 2017 called the Perry Study, Political Economy Research Institute, and that study showed that in California, we would save $37 billion a year and provide everyone with health care equitably, everyone, every resident, and give people what they need. All the health care, it would also take care of nursing homes. Right now we have people quitting their jobs, giving up income because they stayed to, take care of a sick parent or a sick grandparent. All of this would be funded, and still we would save $37 billion. So when those people in Sacramento say, I don't know if we can afford, that is nonsense.
Nonsense.
That is nonsense. And it's not hard to know. All you have to do is look at the research. It's there. And of those 22 studies, 20 of them said that the substantial savings would occur in the very first year. So it's not like you have to wait 5 years, and you're just pouring money into the system. If you invest the money in the system, we are going to get back tenfold. So I just had to throw that in there because it is a nonsense argument. Like you said, because we have plenty of money for cops and military and for destruction. I always say we're a country that spends a lot of money on destroying things and very little money on enriching lives, right? So, anyway, is there something in addition that you would like to say about?
No, I think for me it is what you just talked about, and what many of us know about, prove that facts and figures don't help us make decisions.
Right.
Your culture helps you make decisions. What you are taught, what you believe, and what you think. And because we have powerful industries that have access through money that they give, they can take those same facts, turn it on its head, and then simply say to an elected official, well, you can't do that. Can't do that now. Yeah, I know what they said. I know those 17 studies, but here's what will happen. And then we wound up not moving, not doing anything. Part of what we are, as a society, are going to have to struggle with it, and I've struggled with this at least for the past 52 years. How is it that, and I saw this interview a year ago, the earned income tax credit for children, that you got for your children during the pandemic and the rest, brought over 3 million children out of poverty. So they're interviewing this woman in Alabama who got the earned income tax credit and talked about how, it helped her and the rest. But then she said, some people don't deserve it. And some people are taking advantage of it. And some people are misusing it. And she says she doesn't support the extension of it. She was a white lady. And you think to yourself, on the one hand, she's talking about how good it was for her and how great it is. But then she's saying, but I don't support it being extended. I don't support more of it. I think that, and she talks about some people misused it, some people abused it, they didn't, And I think to myself, what can I say to that woman? Probably nothing. But what could be said?
I got some words.
But what could be said to help get her to see, understand, and accept that she is undermining her own self, that what she's doing is damaging herself. How is it in a society where we can get people to vote against their own interests consistently, regularly, and almost white supremacy is a good way to start it. But at some point, and as an organizer, and particularly as a labor organizer, I've had to sit in rooms with people, and we talk about how, I'm not going to even use my own experience. I'm going to use the experience of organizing Amazon workers, and organizing auto workers in Tennessee. Here's what the anti-union busters did. They said that if there's a union that comes in here, it'll be mostly of black people, and black people will benefit. And you won't be able to get the kind of promotion and advancement that you deserve. And that worked. In the Amazon struggle that's going on in the South right now, one of the things that the union busters learned was that if they project that it's going to be a predominantly black or largely black or significantly black, because a lot of the people who work there are black union, then they simply say it's going to be a black union and you'll never get what you deserve. And people will vote against their own interests. Now you would think, and I've had to make the argument as a labor organizer that we're gonna all benefit, we're gonna all get a raise. It ain't like the black folks gonna get a raise and you ain't, or the black people gonna get something that you're not gonna get. But there's one other element that we cannot be able to quantify, and that's racism and white supremacy. The belief that somehow my position of being white or being in this privileged position is better at least than being black. And I'm not prepared to cross the street to help you. And that, unfortunately, we know the problem, we know the solution, we know the benefit of the solution. Getting people to see, understand, and accept has been as an organizer, I can get people to see it. I can even get them to understand it. Can I get you to accept it? That has always been the struggle. And so what Sheila has outlined, we can spend money on police. You know why? Because we got a gang problem. Now, you don't have a gang problem where you are, but there's one here. And if we don't control it and suppress it, because that's what the police are taught, then it'll be where you are. And we can't allow that to happen. And so we're willing to pay whatever for the police. That same attitude is keeping us from getting simple solutions accepted and implemented. But it means our struggle has to be more as intent, has to be as focused, and we have to, I got kicked out of a meeting today, and this was the wrong time for me to, and this one I actually apologize for, because it was an outburst on my part. But there are times when, if you look at the advancement of any issue or concern, it centers around three things: a demand, that demand ultimately results in a challenge, that challenge results in confrontation, those confrontations disruptive. I have not seen change made any other way. Now I have not seen any change made based upon enlightenment. Like, oh damn, that's a good idea.
Unfortunately not.
Yeah. So it takes those things.
A question for you
Yes.
then. Do you think, how much impact do you think changing the system so that each and every one of us brings the same dollar amount for our health care? It is not going to erase like all racism, for sure, obviously not. But do you think that will have an impact or not? Do you think it will have a substantial impact on the system? If we get rid of the tiered care, everybody has the same card, everybody gets the same care. I know it's not going to change a lot of attitudes right away, but do you see that as a step in that direction?
Certainly, I wouldn't be a single payer supporter if I wasn't. But what you are arguing is a practical, logical approach, and what I'm responding to is my culture and my emotions, which is I don't want to be in this shit with the rest of you. That's or they gonna take something that belongs to me. Or
then you know what? Give him the ticket to Elon Musk's flight out of here, okay? Because it's
but we won't be able to do that.
It's a very small planet with a lot of people.
But we won't be able to do that. And if we will have to make the argument, the logical, practical argument that you just made, but unless we couple that with the willingness to either shut the shit down or make it so uncomfortable for people to operate that they have no other choice, then the logic, then I can become logical. It wasn't logical for, it was logical to give women the right to vote. That made sense, didn't it? But it took from 1848 to 1920 for you to get it.
We still don't have era. Sorry.
There you-
we
and
don't
you
have it.
still don't have the
Sorry.
equal-
I marched for that in 1972.
There you go.
We still don't have it, okay? That's like 50
So
years
it's
ago.
part of what we tend to do, I think, is focus on the rational,
Yeah.
as opposed to understanding the emotional.
Yeah.
Okay, we're talking about culture here as well. As a doula, your profession has not been given the respect, the dignity, and the money, and the access to patients that it deserves. CalCare includes all kinds of, medical services that are not like traditional Western medicine, and doulas is one of them, along with acupuncture and herbal medicine, things that have shown efficacy. We know that doulas have a better rate of delivering babies than in the hospital. So, do you think? What do you think about the expansion of the cultural choices, the choices that people have? Do you think that is going to make a significant difference in, for instance, what you're doing?
Absolutely. I mean, I would like to correct one thing. Doulas don't catch babies, midwives do.
Oh,
Doulas
that's right.
support and
support. Okay.
advocate.
But still, you do have a really good track record.
We do,
Yes,
and
you do.
actually, because of the amount of attention that was given in 2020 to Black folks for a microsecond, there was actually a lot of talk about the fact that about the Black maternal mortality rate, and out of that, a lot of counties and states started to look at doulas and say, oh wait, you actually have an effective way at intervening in the high mortality rate for both infants and mothers. And so a lot of places started to implement that, and they see that the death rates have decreased for both mothers and infants. So it's actually incredibly effective. And I think it's incredibly important that we give people choices, right? You can't tell somebody how they need to take care of themselves, because one, doctors don't know everything, and two, doctors do not listen to people, especially Black women, right? We see how there's a lot of research that has been done about the fact that a Black woman and a white woman will come into the doctor, present the same exact symptoms, saying that they are in pain, right? A white woman, we'll start with that. A white woman will be given sympathy and Vicodin or Percocet. A Black woman will be told, suck it up and take some Tylenol. And that is literally what the research has shown. And so it is important that we are able to advocate for ourselves, and we're able to say, no, one, I want to see another doctor and I want another opinion. And two, I want to be able to see somebody who looks like me and who understands what I'm going through, because in the other thing that we've seen that has been able to intervene with the infant mortality rate for Black infants is that when a Black infant is seeing a Black doctor, they're more likely to survive.
Right. Wow.
And so that's why it's so incredibly important that we are funding other hospitals and that they're giving equitable funding, because that allows Black doctors to come into communities that they've come from and that they look like, right? So that then they're able to see patients that they understand, and they're able to give comprehensive and
Culturally appropriate.
and culturally appropriate care, because that's incredibly important. That is literally what saves lives and interferes in medical apartheid, right? That is the best way to intervene in this process. And so I think it's incredibly important that people are able to access all different types of healthcare, because we have seen that Western medicine can't solve everything. And we have seen the way that Eastern medicine and non-traditional medicine, which, let's be honest, non-traditional medicine has existed longer than quote-unquote traditional medicine. So the reality is that the non-traditional is actually traditional, because it has existed longer, and it has been proven to work, right? And so people need to be able to advocate for themselves, need to be able to get second choice, second opinions, and need to be able to see whatever doctor or provider they want. And one thing I'm going to add in here too is that they need to be able to have full autonomy in deciding what it is that they want. And I'm speaking specifically about the fact thinking about gender affirming care, thinking about infertility and fertility treatments, thinking about the number of people who are denied access to care that they clearly need because of insurance companies, because of hospitals, because of culturally incompetent care. So it's incredibly important that we have comprehensive and holistic medicine that goes outside of the bounds of traditional medicine, quote unquote, westernized medicine that has all too often failed many of us.
And you know, when patients actually have a when patients actually have a choice, your doctor's gonna listen to you. Because that was one of the things found in the research too, is that people of color say, doctor didn't listen to me. They didn't listen to me. They didn't hear me. They didn't ask me, you know? So when you have choice, I'm glad you brought up choice. Choice means you don't like the treatment you're getting somewhere, you can go somewhere else. And CalCare does that. You have complete freedom of choice. And that is going to, I think, really improve the practice of medicine and improve what takes place in these hospitals.
And it will literally save lives.
Yes.
I'm going to be real here. I have endometriosis. It took years for me to be diagnosed.
So painful. Oh.
The number of doctors who told me it's in your head, suck it up, that's part of being a woman, that's part of having your period, that's normal, you're depressed, all these different things that I heard. And I was like, no, there is something physically, it is not normal for me to drop to my knees multiple times a month, every single month, because I'm in that much pain. That is not normal.
No.
And the fact that I had to go through multiple doctors in order to be able to actually get diagnosed, and then had to fight against the fact that they said, well, the one way that we can diagnose you is by doing a laparoscopic surgery. Which I'm like, so you want me to allow you to cut into me to explore if you have it, and then you want me to sign a waiver that you're able to do whatever you want once you're in there, and I'm asleep and don't know what you're doing, so I literally might lose my uterus in the process when we know that you are more likely to sterilize a black woman? Wow. Hell no, you are not about to go up inside of me just to explore and figure out what it is that you think might be wrong with me. So I said, what else might, what else? I was very lucky in this moment in the fact that I had just gotten back on my parents' insurance because of the Affordable Health Care Plan, and was able to get back on my parents' insurance and had another insurance simultaneously. So I had two insurance at the same time. And I said, what else could it be? And he said, well, it could be this or this. And I said, great. What are the diagnostic criteria for that? And he said, this and this. I said, that's less invasive. So if it can be one of three things, and the one thing is really invasive to do a diagnostic procedure, why don't you test me for those other two things that are not invasive, and then by default, I have endometriosis. Duh. And he's like, well, I hope you have really good insurance. I said, I do, and I have a secondary insurance. He said, then let's do it.
But that should have never been the question. That should have never been the question.
No.
I hope you have good insurance.
Exactly.
And that is the breakdown in the system. You better say something quick.
Okay,
We're gonna be
so
all
what
right.
I want to say is thank you so much. We do, I know it's late. I know there's some people in the audience who have a few questions. If we can just spend a few minutes just answering their questions. And thank you.
This panel blew the film away.
Yeah, blew the film away. I want to just ask the first question. I'll be really quick and then I'll take it off stage. I know CalCare, I've read it from last year, and CalCare is not just a healthcare bill, it is also a racial justice bill, it is a housing bill, it is a jobs bill. And I want to say that any elected legislator that does not support this bill is supporting unnecessary suffering, death, and racism. So I just want to make that clear. If you do not support CalCare, you are supporting the white supremacist system that is causing violence and death. I'd like to know what you think about that. Thank you. Do you agree?
Raise your hand if you do.
You want to start? I absolutely 100,000% agree. Because again, looking at the social determinants of health, right? Looking at all of these factors that lead Black folks to be be in a situation where we are more likely to experience certain things, right? And then are less likely to get quality, comprehensive, competent, culturally appropriate care. It absolutely is, it speaks volumes of a person's character, whether they are an elected official or a person if they do not support single payer health care. I'm gonna say that outright. And it is a racial justice issue, point blank, period. It is a social justice issue, point blank, period. It is about investing in things that actually keep us safe and actually care for us, as opposed to investing in death-dealing systems that include the police, prisons, and our currently existing healthcare system.
And you all should know, I mean, if you know me longer than 3 or 4 minutes, that in 1994, I, along with some of, a group of people who were part of a coalition that put a single payer initiative on the ballot. Now, we didn't win, and that was a bad year for us, because that was the year that Newt Gingrich came in and became speaker. So, I mean, I have been fighting for single payer, like I said, since the group I was with, Neighbor to Neighbor Health Security, I mean, we actually had a town hall in Little Rock, Arkansas for 2 days and confronted the Clintons with our little single payer card. So I have been around single payer. I've got a chance to work with Canadians who work in a single payer system, single payer Canadians who healthcare providers. So I've grown to try to first to understand it. And here's the good thing about single payer. It ain't like you need, you got to be a rocket scientist to get this. So it is pretty simple. What it always runs up against, though, is the cultural influence. Right. Well, but if we, that kind of thing. So certainly, I think you all know where I stand on single payer. I have been a single payer advocate for 35 years, more probably.
That's why we're gonna vote for you for Assembly 57.
And if you don't vote in that, you can always, write a check.
Yeah.
And how do they pay
Send
you?
some money.
How do they support your campaign, Bob Keeley?
Good question, and thank you so much for asking. Well, you can go to akiliforthepeople.com and you can find out. And as a matter of fact, one of the things that I do, because the tool that politicians use is we talk about universal health care. And when people came up, I said, no, I support single payer.
Yes.
And I want that, it's written in my literature. And so I don't want any illusions. I don't want, to try to, I'm ducking or dodging. I support, and I will be, and it's one thing to support something. I support a lot of people. It's another thing to be a champion for something. And that's what I want to be. That's what I have been, is a champion for this. And so you can go to Akili for the People, and that's my .com, and that's my website, and find out about why it is that I have 4 basic positions. Well, 4, can you believe that? But one is, of course, housing, and what we can do about housing, and the second one is single payer. But both of them are under the headings of human rights.
Yes.
The housing is a human right. No, we have to have shelter.
Yes.
Healthcare is a human right. As a matter of fact, and I say this all the time, if I went to court tomorrow and I didn't have a lawyer, the court would appoint a lawyer for me. Now it may not be the best lawyer, but I'd get one. How is it that we can be in a car accident, and what they ask you about is, what insurance do you have? I mean, who does? Why would you do that? So anyway, yes, you can go to akiliforthepeople.com and learn about my single payer position and why I support it, why I will fight for it, and why I'll be a champion for it.
I make a comment. I believe one thing we should all keep in mind as far as culture is concerned is technological innovation. That's never going to stop, at least as far as I'm concerned, as far as we're all concerned, as far as we're living. With technological innovation comes the widening of the gap between the haves and the have-nots. So even when we do switch our healthcare to something more efficient, we will still have that, and that bleeds into everybody, because day and ages, people are willing to pay to have a personal number to their doctor so that way they don't have to go to an urgent care hospital or whatever they need to go to. Not everybody has that access. So bear in mind the idea that we still will always have a means of needing to fight for each other, because that gap will increase no matter what, because we will need to advance technologically, and we can't keep everybody in mind all the time because we have to survive on our own. So we just have to try to find different ways to close that gap as it keeps getting wider.
Yeah, but I'm not prepared to accept that it will get wider. I'm prepared to fight not only to try to close it, but to equalize it. As an organizer, almost the second lesson you learn is that the first lesson is that we do with people, not for people. The second lesson is that all organizing is about equalizing power relationships. And if we don't do that, then there will always be the haves and the have-not. There will always be the gaps. There will always be those with and those without. And so as an organizer, I have to believe that I can equalize the power relationship with the people.
So basically it's the reverse of it. If it's good for the goose and it's good for the gander.
Or better yet, if not the bosses or the rich and the well-connected don't have all the power, the people can have power, do have power, if we're willing to, one, take it, and if we're willing to use it in our own behalf around our own interests. And as an organizer, that's the third one. So one is we do with, not for. The second one is we equalize power relationships. And then finally, it is to make sure that we protect, promote, and defend the interests that we say we have, and we do it in our own interest. And so I'm always prepared to argue for, just because we're sitting at the table, or we got to fight to get at the table. But once we get there, it is to equalize power relationships. I do not believe the bosses have all the power. I do not believe that the rich have all the power, and I do not believe that because they say they do, that there's nothing we can do.
That's on another Tupac quote: "The power is in the people, and politics they address."
And the CalCare addresses what you were talking about, because in CalCare, you, the governor, Cecil, my grandkids, everybody, your legislator, has exactly the same care. Exactly the same. There is no private care. There's no penthouse care for some, bargain basement for the others like we have now. Medicare, Medicaid, all of these things disappear. The governor has the same card you have. And I'm going to do the three things, Akili.
Oh, three.
Are you ready for 3 things?
Well, let's hear this.
All right, 3 things. If the governor and you and I and my state senator all have the same exact care, the 3 things are going to happen. It's going to be good. You're going to have everything you need, and it will never be on the chopping block for funding. It will always be well funded. And the only way is that's going to happen is if we are all in it together, talking about equalizing the power, because that's the power of the dollar in the healthcare system. And so we cannot allow any of this, oh yeah, we'll just expand Medicaid. That's a big thing now, expand Medicaid. No, we don't want that. We want the governor and you to have exactly the same care. And then you will have equal power in the healthcare system and have freedom to go where you want, no networks. You have the freedom to say, I don't really like this doctor, I'm out of here, and you go somewhere else. So the freedom and the access to exactly the same thing that everyone else gets, that's power. That's power. Oh, yes.
Just quickly, I'll say it like this.
Hi, how are you?
Hi.
I remember
Most
you.
folks know me, Michael.
Hi, Michael.
It reminds me of historically like the Social Security. The reason why it's so hard to get rid of is because we're all in it. I mean, there are politicians that are trying to get rid of it, but it's hard because all of us benefit from it. And it reminds me of this fight. If we get it, all of us benefit from it.
That's right.
It's really hard to get rid of. Nearly impossible.
That's right.
That's right.
If I didn't know no better, Michael, I would think you and I have been talking for the past 15 years. As a matter of fact, one of the things we learned when we put that initiative on the ballot in '94 was that if we explain single payer like Social Security, people will get it. And they did. That's how we got the signatures to get it on the ballot. What we didn't get was the $10 million we needed to run a statewide campaign, and the insurance companies and the pharmaceuticals did, and they frightened people with, and I don't want y'all to run out of here screaming with. And that frightens people. Socialized medicine, yeah, and they use that to frighten people into thinking that, well, but underneath that was this notion that everybody's going to get what you got, and if they do, then you'll have less of it.
But you're going to get what the governor gets, and you are never going to have less of anything.
But that's how. And that's how, in part, I think we lost it in 1994.
Well, and I think what I would add to this conversation is that, one, what came up immediately for me when you were talking about technology is how technology itself is racist, right? We see how the faucets that are supposed to recognize skin, right? When you put your hand underneath it so you can wash your hands, is less likely to recognize highly melanated skin, right? The fact that self-driving cars literally at the beginning, and they're still trying to fine tune it, could not tell the difference between a black person and the fucking road. Yeah. Like, technology is racist because the people who are creating it is racist, have racist tendencies because you were living in a racist and anti-black society, right? White supremacy is not the shark, it is the water that we are all swimming in. And so we have to...
That's really good. That's really good.
And like thinking about, the way that even the medical system teaches people, right? Like how many people actually know who Henrietta Lacks is? Right? I'm glad. I mean, in this room, I'm sure a lot of people do, but in a general room, probably not, right? Or the fact that when you're taught about whether or not a person is at risk of not getting enough oxygen or being oxygen deprived, what do you always hear? They turn blue. A black person is not going to look fucking blue. They're going to look gray and ashen. And literally, people are not even being taught basic things about how to care for black people. And then they wonder why we have such high mortality rates. Hello? Like, you are literally being taught not to care for us.
And this is definitely a problem now in the medical system, which is trying to squeeze labor to make more money, right? They're putting in a lot of these electronic systems that are basically directing physicians and nurses. They're de-skilling nurses and they're de-skilling doctors. They're taking away their professional education, their experience. As a nurse, when I went to nursing school, you learn the first thing you do when you walk into a room is you use all 5 senses and you assess someone. You look at their color, you smell, is there an acidy smell, is there some kind of smell, you touch, you listen, how are they breathing, you listen to them talk, are they like coherent? I mean, that's what you do before you do anything. You walk in, you greet someone, and you assess. This is being replaced
with algorithms.
With algorithms written by, computer people, technology, to remove the nurse from the room, and actually to remove you from the room and do something called heal at home. Stay home, get on your computer, and talk to the doctor on the computer and die. You got it. Because in fact, people are not aware of their own condition. I know when I'm sick, I'm in denial. I'm fine until I drop, right? So, it doesn't work that way. You've got to keep the care in the system. We do not have a healthcare system. We have a health insurance system. Right. And insurance is a business. And the only reason it exists is to extract money away from the patient, to give you as little as possible, to squeeze the employees, squeeze labor, right? And then to consolidate and monopolize so they have total control. And now bring in computers to replace the human beings that want to touch you, look at you, engage with you. That's not healthcare.
I think Miss Italy has the last question, and then we'll wrap it up.
Okay. So I've always felt like knowledge. I've always felt like educators were the most unappreciated people on the planet. To the point that when I meet an educator, I always tell them thank you for your service, because they're literally doing the service because it's literally pennies on the dollar, right? And I've always felt like the most beautiful, most loving thing that you can do is to teach someone something, to educate them, right? And like I told the doctor when she left, I want to say thank you for this blessing that you guys share with us, and thank you to the host for the really deep, in-depth questions that you asked them to help dig it out of them.
Thank you.
I come around
it's
you guys.
not hard to dig on these people.
Right. I was
It's
going
more
to
like
touch on that
volcano.
next. I come around you guys because I need to see blackness in its greatness in this capacity, and it's just amazing. You guys absolutely shot that to the point that I now have to start picking you guys' brain, and I need to ask each one of you guys for a book off your shelf at home. Whenever you're at home and you're thinking about, I would like Miss Italy to learn this, I want you to just grab a book and give it to me the next time you see me, and I'll return it and take good care of it. But I have to start picking your brain and getting where you guys are, because this was absolutely, you guys shot this. My question is there anything that a person can do short of fighting for CalCare, like is as important as Measure A, right now? Is there anything that people can do right now? Like, do we stay away from big hospitals and only deal with little clinics? Is there anything that a person can do right now, personally in their medical care, to get something that resembles single pay? You know, because I'm experiencing at my doctors that the test that I'm asking for is no. I literally had to have Max take me to another primary care physician because everything I asked the doctor for is no. And after hearing you guys talk, I just realized that I've been experiencing a what do you call it, medical apartheid?
Yes. Caste
I'm
system.
absolutely disgusted.
Yep.
To the point that I'll be writing a medical review on the doctor tomorrow.
Yeah. So a few things. One, advocate for yourself. Two, don't go to a doctor's appointment by yourself. Which is all ridiculous that we have to do these things, right? Three is, I would say also, I have found a lot better care by seeking out Black care providers. And that's hard to do. But if you need help, I got you and can help. Also, what I would say as well is that not only fighting for CalCare, but fighting against that other bill, right? That is trying to pretend like it's going to advance single-payer healthcare when it's not, which is 770. Needs to not see the light of day. It just made its way out of suspense today, didn't it? So I would say contact your representative and ask them to not support the bill. I believe the next committee is going to
a floor vote.
It's going to a floor vote next.
Yep.
So you need to contact your representative and ask them to not vote for it, and heck, call everybody and tell them not to vote for it. The other thing I would say as well is that we have to remember that part of the reason why this is happening is because politicians forget who they're held accountable to. Politicians forget that they work for us, that they represent us, and that we pay their salary. And all too often they are too beholden to lobbyists, and that includes lobbyists for the pharmaceutical industry, for hospitals, for insurance companies. Look into who your representative is being paid for by and who bought them.
Got it.
And make sure that they know that you know who bought them and who they're actually beholden to.
There's a site called Follow the Money. If you Google it.
She can go to our site.
Oh, that's right. Explain that.
Well, so there's like, we have a list of like, here's, where you can find your assembly member, who it is, their phone number, and our website is HC, as in healthcare, 4us.org. We have a CalCare petition you can sign. We have a script you can say when you call your assembly member. And I would say, when you
State
call
Senator.
your,
Excuse me, A is in Apple, C is in Charles, for
US.org. So when you call your representatives, you can ask them, do you support CalCare, and tell them if they don't, are racist.
Right, absolutely. Isn't it clearly displayed if they don't support it? It's like blatantly they're saying, I hate everything that's not white.
Right.
But the problem is they say they're for it.
Oh.
But they're not.
No, they'll say they're for single payer, but they have some questions about CalCare.
Or have
So the
concerns.
question specifically is, are you going to support and vote yes on CalCare?
Right.
That's our single payer bill. And if they say anything less,
Other than yes.
other than yes, they are not supporting.
Baba Keely, so this is gonna be, CalCare is gonna be your driving force of your campaign, huh?
Absolutely.
Yeah.
But once again, I mean, well, there's a question in the back, and I want to be able to get to it.
Sorry.
But no. I want to. I think what you ask is the democratic question, really. That how is it that, and I said this earlier, we know what the problem is, we know what the solution is, and we know what to do. But somehow or another, we can't get to it. What's the holdup?
Yeah.
And part of it is part of the reason why I became a candidate. What I observed is that politicians talk to other politicians. They talk to staff and they talk to lobbyists. They don't talk to you.
Right.
And unless you bake it in, you build it in from the beginning, then they'll continue to talk to those three groups of people. And the lobbyists walk up and down the halls with them. That's why they call lobbyists. And they give them money for access, so that they may not even agree with them, but because they came to a breakfast or they paid money for a dinner, then they at least get a meeting with you. And part of that, what that does, is that means that they get unequal access and unequal influence. But you vote for them, and so you get the short end, but the lobbyist gets the long end. And so I think that's ultimately we're going to have to change that system. And so the idea of going to the website, making the calls and the rest begins to do what I talked about earlier, equalizing the power relationship. Most elected officials do not expect to get called at all.
Really?
No, shit no. Why would they be called? They're 800 miles away or 2,000 miles away. And now the local city council person, that person may be a little different. But if you're in Sacramento, ain't nobody gonna call Sacramento. If you're in Washington, ain't nobody gonna call Washington. And I don't expect for you to show up at all.
Yes.
Under no circumstances on me. So I can do what I want in Sacramento. And one of the other things I want to do as an elected official is just have an open house where you can just come see me. You don't need a, and have. and have.
Some of us might not living there.
Yeah, well, and have town hall meetings, community town hall meetings. But part of that is
community house.
yes. But part of that is how do we support and sustain democracy, the democratic process. And so what this is about, and what the information that you were given is about, how do we engage in the public decision making that we need to be a part of, and make sure that the people we decided to represent us hear from us. They don't expect to hear from. It is said that a letter in a member of Congress office is worth 1,000 because they don't expect letters at all. Now there's these turf organizations that can generate these letters, but the idea that you would call, the idea that you would take the time to make a phone call to an elected official really begins to say a lot. Now they tend to be a little dismissive because they think, well, I can get away with it because you ain't gonna see me. But if we can get enough of us to call, and enough of us in this case is 10. 10 people. Can you believe that? 10 people. If 10 people call an elected official with all the same, you should do this and this, that makes an impact. 10 people.
Really?
20, shit, yeah. Yes, because I'm telling you, how far is Sacramento from here? 830 miles? You ain't gonna see me, you ain't gonna. And so the idea of you calling me, taking the time, first of all, to do it, and then having a message with it has an impact. Now, the downside is, because I'm away and I'm not immediately accessible to you, the inclination is to be a little bit more dismissive. And you think that, well, I can get away. But the fact that we do it, I think, sends a message. So don't ever underestimate the calls and the petitions and the signing the petitions, writing a letter. Never underestimate that stuff, because it on the other side are well-paid lobbyists who are constantly saying we can't do that, or constantly saying you shouldn't do that, or this is not the time, or what will happen to my industry. So, and they got complete and utter access to them damn near whenever they want. I mean, one of the good things I'm comfortable with, I'm not taking any corporate money.
That's right.
Well, wait, don't applaud, because that shit wouldn't be offered to me anyway. I mean, if you look at my history, I mean, I can afford to say that. I mean, come on now. I mean, if you look at my history, what corporation is gonna give me money anyway? But I can afford to say that because I know that, but
You literally are with an organization called Corporate Accountability.
accountability, yeah.
Oh, shit.
So you know that. But if more of us did that, and we had a mechanism so that the people invested in if there's a private in industry that pays for public policy, we always get bad public policy. And right now, the private industry, that all the rich, all the corporations, they influence public policy, and that's why we get such bad one. I don't mean to lecture you on that. Most of that and I want to try to get to that question in the back, because I know brothers like, shit, I ain't holding my hand up no more.
I'm gonna have to leave, but
see, I'm glad I got to you, bro. Damn.
By the way, this is a fantastic educator, okay? This guy is an educator. Bill.
First of all, thank you all for what you're doing. I have 3 different things. I'm going to try to correlate them all together. The first, behind the gates of the great Azores, behind the gates of Hercules, before you only sealess shores, before you only shoreless seas. What that means is, this is wonderful and well and good, but we're speaking and singing to the choir. The example that you gave earlier, sir, about the woman who benefited from the grandiose opportunity of having the write-off and the child care, but she didn't think of having enough humanity for anyone else to have it. That relates to that point, by the fact that she can't see beyond the sealess shore or the shoreless seas for anyone else but herself.
Wow.
So we must go to the people to let them know that they must see for other people. That's number 1. Number 2 is we have to go back to the schools, which I've done my prison term, so I'm not going back, but 30 years. But the idea is our system in education is as broken as the medical system. And Maureen was at my school, well, I was at her school, in her community. But
School.
the idea is, I got in so much trouble. Ultimately, it was understood and I was rewarded for it, but so much trouble because what habitually had been done was not good for the kids. Because all they were doing was teaching the kids how to were conformist absolutists. So when you become a conformist absolutist, you don't know how to think about what is in the best interest for, number 1, yourself, number 2, your family, number 3, your brethren and sistren, number 4, your community. So you end up being manipulated because you've been indoctrinated by what has been taught for the 12 years that you were in school. I taught the complete opposite. I gave them what they wanted with the curriculum, but I did the complete opposite, so I was always in trouble. But after they got the results that they wanted, then, everything was fine, but there was no support because it didn't look traditional. You guys have to go to the people to let them know that they have been bamboozled, and what they are doing is they are following what is in their least best interest. The last part I'll give you is an African quote, an African proverb. And if nothing else, you can approach the people with the proverb. And the proverb is from Uganda. It matters not if the melon falls on the knife or if the knife stabs the melon. In the final analysis, the melon is the victim. So I thank you all for what you do.
Thank you. Thank you, everyone, and go to hc4us.org for more information on CalCare. Good night.